Hello, it's Dr. Elisha Van Dusen with New Hope Chiropractic. What's dehydration and what are some ways that you can treat it? Because when the weather's hot, in summer months, spending time anywhere the weather's warm, working up a good sweat is something that a lot of us want to do. We want to stay outside and enjoy the nice weather. However, long periods of hot, humid climates or exposure to really high temperatures can lead to dehydration. Actually, some surveys show that 60% to 75% of Americans don't drink enough water daily. Up to 30% of older adults actually may be chronically dehydrated. So staying properly hydrated is extremely important. So what actually qualifies as being dehydrated? Well, dehydration occurs when there's a harmful reduction in the amount of water in the body. It's possible to become dehydrated if you lose as little as 3% of your body weight from water depletion. So what are the different types of dehydration? Well, you can have hypotonic or hyponatremic dehydration. This is a loss of electrolytes, mostly sodium. You can have hypertonic or hypernatremic dehydration, which is a loss of water, or you have isotonic or isonatremic, which is a loss of both water and electrolytes. Any of these three types of dehydration can be mild, moderate, or severe. So what's mild dehydration? It's when the body has lost about 2% of its total fluids. That's mild dehydration, 2% fluid loss. Moderate is when the body has lost about 5% of total fluids. And severe is when the body has lost about 10% of all fluids, considered an emergency. And who is most at risk? Well, children and infants, the elderly, chronically ill, people recovering from surgery or a virus, endurance athletes, high altitude dwellers, those living or working in very hot, humid conditions, farmers, miners, military personnel, construction workers, firefighters, forest workers, park and rec employees, industrial personnel, people who sweat a lot and have high fevers, people who eat poor diets, those with digestive issues, people with hormonal problems, also chemotherapy patients. So if you're one of those, you should especially watch out for getting dehydrated, because that could make you more susceptible. So next video, I'm going to talk a little bit about some ways that you can avoid becoming dehydrated, certain safeguards that you can take. Check us out at newhopechiropractic.com and have a healthy day.